Good morning to all. My name is Professor Aayushi Bansal, and I'm working in College of Nursing, LRM Medical College, Meerut. Today we'll deal with the topic today is the hepatitis B, C, and D. We all know that we have only one liver. Only one liver means that is the largest internal organ in body, and that is located mainly in the upper right portion of your abdomen, beneath the diaphragm and above your stomach, lies just under the rib cage. And the liver has 4 types of specified cells. First is hepatocytes. Hepatocytes are the major parenchymal cells in the liver, play pivotal role in metabolism, detoxification, and protein synthesis. The second one is Kupffer cells. These are the resident liver macrophages and play an important and crucial role in maintaining liver functions. They are the first innate immune cells and protect liver from bacterial infections. They form the lining of sinusoids of liver and involved in breakdown of red blood cells, that is red RBCs. They having the function of immunity, immune function, as well as coagulation. The third one is hepatic stellate cells, and the fourth one is liver sinusoidal epithelial cells. We'll not go into the detail. And moreover, we can say that liver has more than 500 functions, but in today's class or today's presentation, we'll deal with few of them like detoxification, metabolism, production of bile, and cholesterol synthesis. Okay, now reasons of diseases in liver. We can say that alcohol is basically the main culprit or the main reason of liver diseases, as we all know. The second one is non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease, that is because of unhealthy eating habits and lifestyle. The third one is viral hepatitis. And the fourth one is the new virus, that is coronavirus. In today's presentation, we are going to deal with the viral hepatitis only. Okay, so what is hepatitis? As in the PPT, you can see hepa plus itis. Hepa is equal to liver, and itis we all know that is inflammation. The inflammation in liver is caused hepatitis and inflammation in the liver. What is viral hepatitis? Hepatitis can be done और ये हो सकता है पानी या गंदे खाने की वजह से भी, यानी कि एंटारिकली भी, बट क्योंकि हम वायरल हेपेटाइटिस के साथ डील कर रहे हैं तो दैट विल गो विद वायरसेस ओनली. दैट मींस viral hepatitis means inflammation of liver caused by viruses. In this, the swelling or enlargement of the liver we'll see. The microbes or microorganisms like viruses enter in the liver and make it ill. Now, the classification of viral hepatitis. Viral hepatitis can be divided into enterically transmitted, as we heard, like पानी से या गंदे दूषित खाने से. And second one is bloodborne transmission, that is parenteral transmission. Enterically transmitted viral hepatitis comes in as hepatitis A and hepatitis E. Bloodborne transmission of hepatitis is B, C, and D. Hepatitis B, hepatitis C, and hepatitis D. So, first we'll deal with hepatitis B. Hepatitis B is one of the leading and major cause of liver diseases. The causative agent of hepatitis B virus is hepatitis B virus, HBV, that is circular double-strand DNA. And we can say that it is a very common hepatitis we can see in the people. Sero, that is Southeast Asia region office, According to South Asia Region Office, 2% prevalence in general population we can see is in hepatitis B. Incubation period is 75 days, that is 30 to 180 days of hepatitis B. Chronicity may be high risk of cirrhosis and hepatocellular carcinoma. Okay, what is carcinoma or what is cirrhosis? Cirrhosis is scarring of the liver. Scarring means fibrosis of the liver caused by long-term liver damage or permanent liver damage. And the hepatocellular carcinoma is most common type of primary liver cancer, most often found in people with hepatitis B and hepatitis C. Transmission of hepatitis B virus. How it will be transmitted? It can be vertical as well as horizontal. If it transmitted in vertical mode, then we can say mother to child transmission of disease. And if there is people to people transmission, there will be a layman person or health professional to other person. The second reason of transmission is infected needles or needle stick injury, common among healthcare workers and health providers. The third one is sexual or intimate relationships, unprotected sex without barrier method. The fourth one is use of belongings, personal belongings like razors, brush, nail cutter, etc. And the fifth one, last is tattooing. If the person who is doing tattooing is not following the standard precautions and not changing the needles frequently, it can lead to transmission of hepatitis B virus very frequently. Next, we can say blood transfusion. This is the main reason in hospital-generated infections. Blood transfusion, if blood is not tested for hepatitis B virus previously, then it can be a reason of hepatitis B transmission in patient. Some of the myths or misconceptions we can deal, like what are the things, what are the modes hepatitis B virus is not spreading. Hepatitis B virus is not spread through food or contaminated food. Second is sharing food or having food together. The third is breastfeeding. Fourth is hanging out or hold hands. And the fifth is coughing and sneezing. Why we are dealing with the not means of transmission? The simple reason we are dealing it to prevent stigma among the community people. As a healthcare professional, we can say that we are the role model or we are the challenger or we are the initiator for the public or the community to prevent the infection or to communicate with the people in their language, local language that can be understandable for all. So these are the things we should or we must spread out or communicate to the public regarding HBV is not spread through contaminated food, sharing food, breastfeeding, hanging out, holding hands, coughing or sneezing. High risk groups of HBV. Infant born to infected mothers. If mother is infected already with hepatitis B virus, infant can be prone or may be prone to get infection from the infected mother. Sex partners of infected persons, men who have sex with men, injection drug users, household contacts of known person with chronic hepatitis B infection. So the screening must be done for all the family members, healthcare professionals who deal day-to-day with hepatitis B virus patients, and hemodialysis patients who come to hospital for dialysis regularly. Clinical manifestations of hepatitis B virus are fever, mild or absent. Fever can be mild, and in some cases we can see that it is absent also. Second is loss of appetite, tiredness, muscle pain, joint pain, nausea, diarrhea, vomiting, abdominal pain, headache, dark urine, pale stools, and jaundice. Diagnosis, we can say there are three methods or three things other than physical examination and history collection. First is liver function test, that is LFT. If we do LFT of hepatitis B patient, we can say the AST, ALT, bilirubin will be high, and serological markers. Serological markers, like what are the serological markers? Serological markers are like hepatitis C antigen, hepatitis H, HBS antigen, hepatitis E, HBE, AG, envelope antigen, antibodies like, anti-HBS, anti-HBC, anti-HBE, and IgM anti-HBC, IgM, IgG, anti-HBC. The third is molecular testing, that is HBV DNA. HBV DNA should not be present in serum. If present, this indicates presence of virus in serum. Serological markers, HBCAG, HBsAg, HBeAg. These are hepatitis core, surface, and envelope antigens. Anti-HBs, anti-HBe, anti-HBc. These are the antibodies in relation to antigens. Next is IgM anti-HBc and IgG anti-HBc. These are the serological markers. We can say if the HBsAg and HBeAg is present or reactive, we can say virus is present in serum. HBcAg may be not coming in the light because this is core antigen and it is inside the SBS antigen. Treatment of hepatitis B virus. The treatment of hepatitis B virus can be divided into acute infection and chronic infection. Acute stage infection, we see there is no specific treatment, only supportive treatment to the patient is given, like IV, diet, and supportive services. Chronic infection, in this condition, oral antiviral agents like tenofovir or entecavir may be given to the patient according to the indications given by the physician. Regular follow-up, continuously lifelong visits, and regular visits to the hospital must be there. Prevent further liver damage and hepatocellular carcinoma. According to national guidelines, there is a treatment chart for chronic hepatitis B. We can say there are the drugs we can use in chronic hepatitis B patient according to Indian national guidelines. According to this, tenofovir, disoproxil fumarate, that is TDF, 300 mg once daily is given to the patient. Entecavir, adult with compensated liver disease and lamivudine is given as in dose 0.5 mg once daily. Entecavir, adult with decompensated liver disease, the dose will be 1 mg once daily. Tenofovir, alafenamide fumarate, TAF or TAF, is given 25 mg once daily. Prevention of hepatitis B virus. Okay. We have skipped this. Like we are saying, these are the medications for treatment of chronic hepatitis B. But how can we distinguish which medicine is given to which patient? So there are some indications, like some drugs are contraindicated in pregnant ladies or in renal patients or in cardiac patients, etc. So according to the prescription and indications given by the physician order, we can say the chronic hepatitis B treatment will be given to the patients. Prevention of hepatitis B virus. Vaccination is the first and foremost duty of ourselves. in relation to hepatitis B virus. There have been 40 years of hepatitis B vaccine is there for us to serve us. But we are so negligent in this case. We only say HIV and AIDS are life-threatening diseases. This is the common phenomena or common thought in a common layman brain. But likewise, like hepatitis B, like AIDS, these both are life-threatening diseases. So we can say hepatitis B vaccine is more important because hepatitis B exposure is comparatively more prone for the patients. So vaccination is the necessary thing to do to prevent hepatitis B virus. Second is pregnancy. प्रेगनेंसी के दौरान कोई भी ऐसी चीज जो कि हेपेटाइटिस बी वायरस से एक्सपोजर कर सकती है प्रेग्नेंट लेडी का, उससे थोड़ा हमें बच के रहना चाहिए. और साथ साथ में if the mother is having hepatitis B already, then the newborn who is the future newborn with her will be protected from the virus. The third is sexual or intimate relationships. We should use barrier methods at the time of physical relations. Next is needles, stick injury or sharing needles, or using one single needle or one disposal needle to multiple patients at a time. Next is PPE. Personal protective equipments are the key to safety for healthcare workers in hospital premises. So, hepatitis B, we have ended with the treatment and prevention. We are going to the next slide, that is hepatitis C. Hepatitis C, earlier known as post-transfusion non-A, non-B hepatitis, PTNA-NB. The incubation period of which is 2 weeks to 6 months. Prevalence is more like hepatitis B. General population is 1 to 2%, and the 2% is high rate. Anti-HCV positivity is high. Hepatitis B is common with people who inject drugs, dialysis patients, multiple blood transfusion, and healthcare workers. High chronicity potential, as it can be acute and chronic, but the chronicity level potential is 80%. So the chances of conversion of acute hepatitis C to chronic hepatitis C is very much potential, that is 80%. Important cause for cirrhosis and hepatocellular carcinoma. So we can say hepatitis C can cause permanent liver damage as well as cancer of liver. Viral genotypes 1 to 6, like 1, 2, 3, 4, 5, 6. In India, we see the genotype 3 and 1 are common. Genotype 3 is the more commonest, like 70%, and genotype 1 is 29% only. Transmission of hepatitis C virus. So how it will be transmitted? First is needle stick injury. The second is blood transfusion, if the blood is not tested previously. Third is tattooing, if the tattoo person is not following standard precautions and changing needles frequently or every time with the new client. Fourth is injection drug users or multi-drug users as drugs. And the next is dialysis patient or hemodialysis patients who regularly visit to hospitals. Infrequent modes of transmission. There are some modes that can transmit the infection, but they are comparatively infrequent. The first is physical contact, male and female. The second is razor sharps, sharing of toothbrush. Third is vertical transmission from mother to child in pregnancy. Next is clinical manifestation. First sign and symptom we can say is dark orange colored urine or clay colored stool because of the increased bilirubin production and loss of metabolism. Fatigue is common. Fever, jaundice, joint pain, body ache, weakness, loss of appetite, nausea, vomiting, pain in the right side of abdomen are the common clinical manifestations we can see. Diagnosis, how we can diagnose the hepatitis C virus? Enzyme immunoassay. This test checks for HCV antibodies in body in our serum. If the presence of HCV is there in the serum, there will be a reactive or positive test. Second is genotyping. In this blood test, the genotype of which hepatitis C virus is there. Like hepatitis 1 is the commonest genotype in India. Hepatitis C profile serological test. This checks the number and activity of hepatitis C virus in the blood. How it is going to multiplicate and how well it is multiplicating in our body. How frequently it is duplicating itself. The fourth one is liver biopsy. However, it is not common, but in some cases it can be done. In this, a small piece of liver is removed from liver and sent to a lab for test or tissue culture. Liver function test or LFT is the common, in which we can say in hepatitis C, the bilirubin, AST, ALT will increase and albumin will be decreased. Liver function test is done to check the enzymes and other substances made in the liver. Treatment of hepatitis C virus. The good thing with hepatitis C is it is curable. Effective direct acting antivirals we have. Good antiviral range we have according to international guidelines that can treat hepatitis C very well. Genotype-based treatment regimens. According to genotype or specific treatment we can have in India. 3 pan-genotype regimens approved by WHO. But whatever the type of genotype, we can say we have a plenty of treatment guidelines or drugs available in the India for treatment of hepatitis C virus. The whole treatment duration is 12 to 24 weeks. In hepatitis C, it is good, it is curable, but unfortunately, we do not have its vaccine like hepatitis B. Okay, now the treatment of hepatitis C infection. Hepatitis C infection के हम देखेंगे like category of patients. According to category of patients, what is the regimen recommended and the duration of treatment? So regime type 1, 2 and 3. First regime is, in first regime we can see patient without cirrhosis, that is uncomplicated. Patient is having hepatitis C infection, hepatitis C virus in the body, but patient is not having cirrhosis. So we can say this category of patient comes under uncomplicated case. Regimen must be followed like sofosbuvir 400 mg and daclizumab 60 mg is given to the patient for 84 days, that is 12 weeks. The second regimen types in category of patient with cirrhosis compensated. Compensated means the liver is able to function as efficiently as it was before with the help of drugs and lifestyle modification. The regimen recommended will be sofosbuvir 400 mg and valpatisivir 100 mg. The duration of treatment will be 84 days, that is 12 weeks. The third regime type category of patient will be patient with cirrhosis decompensated. In this, sofosbuvir plus valpatisivir plus ribavirin will be given. Sofosbuvir 400 mg plus valpatisivir 100 mg plus ribavirin 600 to 1200 mg will be given for 84 days, that is 12 weeks. In ribavirin intolerant patient, we can skip the ribavirin fully and continue with the treatment of cirrhosis, that is decompensated cirrhosis and hepatitis C case with soposibur and veltasibur for 168 days, that is 24 weeks. The duration of treatment will be increased in the absence of ribavirin in ribavirin intolerant patients. How can we prevent HCV? The prevention will be first, needle stick injury or sharing needles. Second, one needle for one person or one patient only. Third is PPE, personal protective equipments we will use to protect ourselves from HCV. So the next will be discussing hepatitis D. Hepatitis D is called a defective RNA virus. Defective RNA virus because hepatitis D virus cannot survive in the absence of hepatitis B virus. To show its impact, it needs the presence of hepatitis B virus, and the hepatitis B virus patient and hepatitis D virus patients make a deadly combination of the patient with very difficult management. It is very difficult to manage the patient with hepatitis B and hepatitis D. Requires hepatitis B virus replication for its multiplication. It is totally dependent on the hepatitis B virus. Occurs as co or super infection with HBV. It occurs as co-infection, like एक साथ भी हो सकता है ये hepatitis B and hepatitis D, and super infection यानी कि पहले hepatitis B हो गया और उसके कुछ दिन के बाद पेशेंट को हेपेटाइटिस डी डायग्नोस होता है, तो इसको हम कहते हैं सुपर इन्फेक्शन. इट लीड्स टू सिवियर कोर्स ऑफ लिवर डिजीज इन पेशेंट and it can lead to chronicity in patients. The diagnosis will be made by PCR, polymerase chain reaction test, IgG anti-HDV or IgM anti-HDV. The treatment will be supportive care will be given in acute HDV, hepatitis D virus, and in chronic hepatitis D virus, high dose interferon alpha with or without tenofovir may be used. Okay, what is interferon alpha? It is a immune therapy given to the patient. In this, ready cytokines given to the body of patients to robust its immune system. Prevention of HDV. First, vaccination. Vaccine is available for hepatitis B virus, so we can avail the facility. And as healthcare professionals, we can encourage the other peoples also in the community, in our family, our relations, our students, our parents, our spouse, for prevention of HDV through vaccination. Second is sexual contact or physical intimacy in absence of barrier methods of contraception. Third is personal protective equipments, PPE, used by healthcare professionals in hospitals. These are the measures so that we can prevent HDV very well. Next is nursing management of hepatitis. Nursing management is very much important aspect in case of hepatitis because hepatitis is a social stigma more in compare of a disease itself. अगर हमें लगता है कि हमारे आसपास कोई हेपेटाइटिस बी, सी, डी का पेशेंट है या हेपेटाइटिस ए या ई का भी पेशेंट है, तो हमें एक लगता है कि उसको छूने से ही केवल किसी को हेपेटाइटिस हो जाएगा. तो एक स्टिग्मा या एक दूरी हम उन लोगों से बनाकर रखते हैं, उसको हमें मिटाना है. तो एज अ नर्स और हेल्थ प्रोफेशनल हम क्या कर सकते हैं? सबसे पहले आ जाता है क्लाइंट और पेशेंट एजुकेशन. पेशेंट को एजुकेट करना होगा और साथ साथ में उसके फैमिली मेंबर्स को भी एजुकेट करना होगा. क्या एजुकेट करना होगा? टू प्रिवेंट द फर्दर ट्रांसमिशन विद फैमिली मेंबर्स एंड इन कम्युनिटी. It is very important to educate patient and their relatives for hepatitis B spread. Second, हमें देखना होगा उनका इम्यूनाइजेशन स्टेटस पेशेंट का एज वेल एज उनके फैमिली मेंबर्स का. So the immunization and vaccine education is very much important aspect. The third is diet. We can modify their diets and avoid spicy oily food, and lifestyle modification will be there. Not sharing razors, sharps, brushes like toothbrushes among them, and timely screening of family members is very much important. Early diagnosis and treatment is necessary in case of hepatitis if the family members are exposed with hepatitis B, C, and D. So the timely screening of patients' family members will be encouraged in the next follow-up visits. Safe sexual partners, safe sexual practices by using barrier methods of contraception. While tattooing, it is necessary to maintain standard precautions and to see whether the tattoo person is changing needles or not with every client. It is necessary to change the needle in every client. Okay. So the tattoo maker as well as community will be educated about tattoo precautions. Regular follow-up visits should be there, and we must educate the importance of regular follow-up visits to the patient as well as their family members. The second one is counseling. Counseling is all about to make rapport, allow the patient to ventilate his feelings, his stigma, his perceptions. We have to build trust. The trust building should be there with the patient so that he can ventilate his feelings or tell his or her story to ourselves. Patient have many W's. W in the sense like who, what, where, when, whom. We have to listen to them very patiently and answer every query, every related query to the disease. How different psychological impact or issue is bothering him. Stigma related to disease. We can say there are so many stigma related to disease, and we have to overcome with our counseling and education techniques. The change perception of the patient and the change perception of family members and community towards the patient. We can see in counseling sessions the perspectives of disease, the signs and symptoms, or the problems he is facing due to the illness, precautions that we have to follow or he have to follow to prevent further infection, the regular or daily practices, what he should do, or lifestyle modification. Tell them all the facts, all the real facts should be told to the patient, and clear all his or her myths. We should not be partial to any person who is having hepatitis infection. First, we have to start from ourselves because we are health professionals and we must not be partial for any patient in every or any case. Third is inpatient management. Inpatient management is very important aspect in nursing management. Different patients have different complications, concerns, misconceptions, disease symptoms. We have to prepare them for different tests, different diagnostic evaluations, different procedures, phenomena. We have to administer medications. We have to we have to make them ready for complications of medicines as well. We have to reduce complications in case if there is any complication occur, and there will be therapeutic compliance for the patient so that we can say and ensure his hospital visits regularly. Next is monitoring for complications. Monitoring for complications in this, we will see the cirrhosis, liver failure, and hepatocellular carcinoma. So it is our responsibility to start treatment as early as possible to improve their quality of life as hepatitis patients. Complication must be addressed early and diagnosis must be made early. In reaction, the treatment will be started early and complications will be prevented